Excessive menstrual bleeding is termed menorrhagia. To understand this, it's important to first define what constitutes normal and excessive bleeding. Typically, menstrual bleeding lasts 3 to 7 days, with a woman losing around 40 milliliters of blood. In simpler terms, a person is considered to have excessive bleeding if the amount exceeds what is typical for them. More objectively, excessive bleeding can be identified if a woman needs to change her sanitary pads or tampons every hour due to them being soaked, and this continues for several consecutive hours. Other indicators include the presence of large blood clots or symptoms of anemia such as tiredness and fatigue. Now, let's discuss the most common causes of menorrhagia. The primary cause is often a hormonal imbalance, typically involving an excess of female sex hormones. Estrogen is responsible for building up the lining of the uterus, while progesterone prevents it from shedding prematurely. During menstruation, a drop in both hormones can lead to heavy bleeding. Conditions such as polycystic ovary syndrome, insulin resistance, and obesity are characterized by elevated estrogen levels and reduced progesterone, leading to an excessive buildup of the uterine lining and subsequently heavy menstrual bleeding. Additionally, fat tissue produces a protein that binds to sex hormone-binding globulin, SHBG, making more estrogen available to stimulate the uterine lining. The second most common cause of menorrhagia is the presence of uterine fibroids and polyps. Uterine fibroids are non-cancerous growths in the uterus, and polyps are benign growths of the uterine lining. While fibroids are muscular tumors that are almost always benign, growing in the wall of the uterus and possibly leading to not only excessive but also prolonged menstruation. Lasting more than 7 days, they are rarely cancerous. Leiomyosarcoma occurs in about 1 in 1,000 cases. Polyps, on the other hand, grow inside the uterus and are attached to its inner wall. They can cause excessive and prolonged bleeding, as well as infertility. Most polyps are benign and carry a small risk of becoming cancerous, particularly after menopause, but this risk is generally low. In terms of size, polyps are usually small, whereas fibroids can grow significantly large. Fibroids tend to be more symptomatic, potentially causing pain during sex or pelvic pressure, whereas most polyps are asymptomatic. The treatment for both conditions can range from watchful waiting to surgery. The third most common cause of excessive bleeding is endometriosis. In cases of endometriosis, the lining of the uterus, known as the endometrium, grows outside the uterus. This growth most commonly occurs on the ovaries, fallopian tubes, and pelvic tissues. The tissue responds to hormonal changes in the cycle, leading to bleeding and pain during periods. The endometrium synthesizes prostaglandins, contributing to inflammation and pain, and potentially causing heavier bleeding. However, the exact mechanism by which endometriosis leads to heavy bleeding is not fully understood. The most characteristic symptom of endometriosis is pain during menstruation. While nearly every woman experiences some discomfort and cramps during menstruation, the pain associated with endometriosis is typically much worse and tends to worsen over time. Endometriosis affecting the ovaries or fallopian tubes can obstruct the path of the egg, leading to infertility. Pain during and after sexual intercourse is also a common symptom of endometriosis, as is pain during urination or bowel movements. The most common treatment for endometriosis involves eliminating menstruation, which exacerbates the condition, typically through the use of birth control pills. In advanced cases, surgery may be necessary.